The patient Michael is a 32-year-old individual born on September 9, 1991, who has a clean medical record. He leads an active lifestyle as a professional athlete. However, he has recently been experiencing specific signs and symptoms such as prolonged bleeding after minor injuries, excessive bleeding after tooth extraction, and unexplained bruising. So for further explanation, here is the timeline. A concerning series of events has unfolded in the past few months. 6 months ago, he noticed that a minor injury sustained while playing basketball resulted in prolonged bleeding. This was followed by another alarming incident 5 months ago when Michael experienced excessive bleeding after tooth extraction. 4 months ago, he developed bruising on his body without any apparent cause or injury. Troubled by the symptoms, Michael sought medical attention and visited his primary care physician 3 months ago. Recognizing the need for specialized evaluation, the physician referred him to a hematologist. 2 months ago, Michael underwent a comprehensive set of laboratory tests to delve deeper into the underlying cause of his symptoms, aiming to shed light on his condition.
So due to Michael's indications and symptoms, which are extended bleeding after small injuries, significant bleeding after a tooth extraction, and unexplained bruising, the physician requested the following tests, which are the complete blood count, prothrombin time and INR, activated partial thromboplastin time assay, and lastly, the specific factor assay. So for complete blood count, it measures the number and quality of different blood cell types. So this is used to evaluate your RBCs, WBCs, and platelet count. So Michael test result values were normal red and white blood cell counts. However, there's a decrease in platelet count. In prothrombin time and INR, this test measures the extrinsic pathway of blood coagulation, and the INR standardizes the results. So this is used to assess the functionality of factors 1, 2, 5, 7, and 10. So the test result values of Michael were prolonged PT and INR, which indicates a deficiency in one or more clotting factors. The third test is activated partial thromboplastin time, or APTT. So this test assesses the intrinsic pathway of coagulation or blood coagulation. So this evaluates the functionality of factors 8, 9, 11, and 12. So Michael's test result values are prolonged APTT, which suggests that there's deficiency in one or more clotting factors. And lastly, the specific factor assay, which directly measures the activity levels of individuals' clotting factors. So this identifies the specific clotting factor or factors that is or are deficient. So the test result values that Michael has a decreased activity levels of factor 8 and 9.
Now for the correlation and analysis, according to the patient's history, symptoms, and test results, the following conclusions can be drawn. First, prolonged bleeding, excessive bleeding, and unexplained bruising suggest a possible clotting factor deficiency. The patient's symptoms, including prolonged bleeding and excessive bruising, are indicative of impaired blood clotting. These symptoms are commonly observed in individuals with clotting factor deficiencies, which can lead to difficulties in achieving effective hemostasis. Next, normal red and white blood cell counts indicate that the patient's bone marrow function is not affected. The normal red and white blood cell counts suggest that the patient's bone marrow is functioning properly. The bone marrow is responsible for the production of red and white blood cells, and normal counts indicate that there are no apparent abnormalities in this aspect. Next, the decreased platelet count may be attributed to consumptive coagulopathy or platelet dysfunction caused by clotting factor deficiency. The decreased platelet count, also known as thrombocytopenia, could be due to consumptive coagulopathy, which is characterized by excessive consumption and destruction of platelets in response to abnormal clotting. Additionally, platelet dysfunction resulting from clotting factor deficiencies can also contribute to a decreased platelet count. Next, prolonged PT, INR, and APTT values suggest dysfunction in the extrinsic and intrinsic clotting pathways, indicating a deficiency in multiple clotting factors. Elevated PT, INR, and APTT values indicate impaired clotting function in both the extrinsic and intrinsic clotting pathways. These prolonged values suggest a deficiency in multiple clotting factors involved in these pathways, such as factor 7, 10, 2, and 5. Next, decreased activity levels of factor 8 and 9 confirm the diagnosis of hemophilia A and B respectively. The decreased activity levels of factor 8 and 9, as observed in the laboratory test, confirm the diagnosis of hemophilia A and B respectively. Hemophilia A is characterized by a deficiency of factor 8, while hemophilia B is caused by a deficiency of factor 9. The reduced activity levels of these clotting factors support the diagnosis of the respective hemophilic disorders.
When ruling in a disorder, healthcare professionals consider the clinical symptoms and test results that strongly suggest the presence of a specific condition. In Michael's condition, ruling in refers to the diagnosis of hemophilia A and hemophilia B. These are the bleeding disorders caused by reduced levels of clotting factors 8 and 9 respectively, which means Michael exhibits symptoms such as uncontrolled bleeding, prolonged bleeding after injury or surgery, and laboratory tests confirm decreased activity levels of factor 8 or 9, and it supports the diagnosis of hemophilia A or hemophilia B. On the other hand, ruling out involves excluding the possibility of certain disorders based on clinical findings and test results of Michael, which von Willebrand disease is being ruled out. Von Willebrand disease is another bleeding disorder characterized by a deficiency or dysfunction of von Willebrand factor, a protein involved in clotting. By performing a specific factor assays, the healthcare professional determined that there was no deficiency in von Willebrand factor and indicating that it is not the cause of Michael's symptoms.
The symptoms experienced by Michael, such as prolonged bleeding after minor injuries, easy bruising, and spontaneous joint bleeds, are consistent with the diagnosis of hemophilia. Additionally, the laboratory tests, specifically the clotting factor assays, confirm the deficiencies of factor 8 and 9 in his blood. The diagnosis of both hemophilia A and hemophilia B implies that Michael has inherited these conditions. Hemophilia is typically an X-linked recessive disorder, meaning that it is more common in males. Inheritance occurs when the affected gene is associated or passed down from the mother, who is usually a carrier, to her son. With the diagnosis established, further management and treatment can now be initiated. The primary goal of treatment is to prevent and control bleeding episodes. This can be achieved through the regular administration of clotting factor concentrates, either prophylactically or on demand, depending on the severity and frequency of bleeding episodes. In conclusion, the diagnosis of hemophilia A and hemophilia B in Michael based on his symptoms, history, and laboratory test results necessitates the initiation of appropriate management and treatment strategies. With proper care, including clotting factor replacement therapy, supportive measures, genetic counseling, and regular follow-up, the aim is to minimize bleeding episodes, manage complications, and improve Michael's overall quality of life.
So for the medical realization, based on the case of a Michael, a 32-year-old male with no significant medical history who is physically active and works as a professional athlete, the potential medical realization for clotting factor deficiency could be the development of a portable clotting factor monitoring device. So the medical realization is a portable clotting factor monitoring device. So this device would allow the individuals like Michael who have clotting factor deficiencies to monitor their clotting levels conveniently and accurately. So the device could be small and portable, resembling a handheld device or wearable gadget. So the features is first, clotting factor measurements. The device would be capable of measuring the levels of the specific clotting factors in the patient's blood. It would provide a real-time information about the clotting factor activity, helping the patient to determine if their levels are within a safe range. Second, it is a user-friendly interface. This device would have a user-friendly interface displaying the clotting factor levels in a clear and understandable manner. It may utilize visual indicators or numerical values to represent the clotting factor activity. Next is the connectivity and the data logging. The device could be connected to a smartphone or computer via Bluetooth or USB, allowing the patient to track and record their clotting factor levels over the time. This data could be shared with the healthcare professionals for analysis and monitoring the purposes. Next is the alerts and the reminders. This device could have a built-in features to set reminders for regular clotting factor monitoring or to alert the patient if their clotting factor levels fall below or exceed the desired range. This would help ensure timely intervention and reduce the risk of the complications. Next is a compact and portable design. Since Michael is physically active and works as a professional athlete, the device should be compact and portable, allowing him to carry it with ease during his training sessions, competitions, or while traveling. So the benefits of this device, it can enhance patient monitoring. The portable clotting factor monitoring device would empower patients like Michael to take active role in monitoring their clotting factors levels regularly. It would provide them with timely information, enabling them to make informed decisions about their activities and potential interventions. Next is it can improve quality of life by having access to their clotting factor levels on the go. Patients can better manage their condition and minimize the risk of bleeding or clotting complications. This can significantly enhance their quality of life and allow them to pursue their athletic careers with confidence. It can reduce healthcare burden. With a portable monitoring device, patients can reduce the frequency of hospital visits for clotting factor tests as they can conveniently perform tests at home or on the move. This can help alleviate the burden on healthcare facilities and improve overall healthcare efficiency. Lastly, the remote monitoring and the patient's clotting factor levels. They can review the data and provide timely guidance or adjustments to the treatment plan if necessary, without requiring the patient to visit a clinic or hospital. So overall, the development of this portable clotting factor monitoring device would be a valuable medtech realization for patients like Michael, providing them with a greater control over their condition and promoting proactive management of clotting factor deficiency.